Proper nutrition is essential during childhood so that a child grows to obtain a healthy height and weight. We spoke to Colleen Trupkin, a registered dietitian at Children's Hospital of Orange County, to learn how important it is to establish good nutrition for your kids.
Nutrition is very important for children. During the first year is an important time when they're introduced to different foods, especially starting at 6 months when they're introduced to solid foods. So we've moved away from thinking that formulated food like a formula is better, whereas breastfeeding is now considered the gold standard, and we want to see children breastfeeding till 6 months, if not a year or more. But I think nutrition's always been important. It's just the way it's been perceived, and the knowledge that we have about it has changed over the years. I think we are moving a little bit away from, or I would like to think we're moving away from jarred baby foods and processed baby foods, but then they come out with things like pouches. So we have to remember as a parent that we're our child's first food advertiser. We really want to get them to show whole fruits and vegetables so that they know what they are. They're not just coming from a pouch or a jar. In the first year, there are some things to stay away from. You would definitely want to avoid honey because there's a risk of botulism. You want to avoid foods that are choking hazards, like whole pieces of hard vegetable candies. Generally, you don't need to be adding sugar, salt, and spices to foods, especially in the early introduction of solids. Sodas, any of that sweetened products that they don't really have a place in the diet. They don't provide a lot of, they're not nutrient-dense foods. The things that we should promote for feeding our infants and children would definitely be whole fruits and vegetables. So yeah, in the first year, trying to incorporate some homemade baby foods would be wonderful, or at least trying not to always give foods in a pouch, because a lot of the feeding experience in early infancy isn't just about the food. It's about making sure that infants have a good experience with the food. So not forcing the feeding. Early on, it's about a developmental process, learning to eat from a spoon, learning to enjoy sitting at the table with the family. So having conversations, it shouldn't just be around making sure that the child eats, and so it should be not a stressful experience for the parent or the child.
Ms. Trupkin discusses what parents should do to teach their kids to eat healthy.
Children can definitely be strongly influenced by their family as far as diet. That's where their nutrition starts, is in the family, at the family table. Later on in life, they're influenced by others. But it really is important to have a strong base at the home of nutrition, good nutrition. In the FIT study, the Feeding Infant and Children study, they found that 30% of preschool children were having less than 1 serving of vegetable a day, and that 25% were having less than 1 serving of fruit per day. Snacks are definitely important for children, especially later in infancy when we're working up on their diet. You want them to have probably 3 snacks a day, because it will supplement their intake. If they don't eat a good meal, the parents can know, oh, we have another feeding opportunity. The older children, what snacks to provide, trying to incorporate more fruits and vegetables depends on what might be lacking during the meals. If perhaps you're not getting enough fruits and vegetables in, that's definitely a good time to try to put those into the diet. Whole grains, if they don't have a lot of dairy in their diet, some cheese, yogurt, low-fat yogurts, low-fat cheese. Those kind of foods are definitely great snack foods. It's really the parents' role to provide healthy foods and a healthy environment for the child to eat in, but really it's up to the child to decide how much of what they're going to eat that's provided. It's really going away from that clean your plate club that we may have all grown up in. My best advice would definitely be to look at your feeding situation, especially with the infants, and if it's stressful, reevaluate, talk to your pediatrician, because it shouldn't be a stressful experience. It should be a really fun time where your child's learning to eat and your child's learning to enjoy eating. And it's a very impressionable time, and so I would definitely encourage you to seek more advice from your pediatrician if that's not happening, because your child can feel that stress and it will impact their eating.